Lipoabdominoplasty. I'm going to say it right off the bat because I don't know if I can get through it again. But Dr. Rhys Branman can tell us all about it.
That's
Good to see you.
Good to see you.
Yeah, welcome. Hope you had a great weekend.
I did. It was wonderful.
Good.
Spent it in the pool, just relaxing.
We needed to be somewhere near water for sure, and probably will later.
That's
well, let's talk about this because a lot of people at the pool, they're not happy with their midsection.
That's right.
And this is something that can fix that.
They go to the pool and they say, uh-oh.
Yeah.
That's right. But the clowns here, no clowning around with that.
No clowning around.
So, but really, lipoabdominoplasty is the combination of actually liposuction and an abdominoplasty. So we've talked about abdominoplasty.
Right.
And we've talked about liposuction. But when you combine them together, you get this really great effect of getting rid of the fat as well as tightening the loose skin and the loose muscles.
Okay, so that's what the abdominoplasty part is.
That's the abdominoplasty part.
Tightening the muscles.
And then with the liposuction part, you get to refine the stomach. You get to take off that little extra that's on the hips. Or you take a little extra that's in the upper belly, which isn't affected by the tummy tuck at all. And so it's really a great combination, and we really see a lot of good use for it, and it's been refined over the years, so it's a lot safer now and a lot easier to do.
A lot of people need both of those procedures.
They actually do. They can't just do one because they just won't get the results that they're happy with.
Okay, let's look at some pictures.
Sure,
You've got before and afters, and those really always tell us the story.
Now, this gal had a little bit of loose skin on the lower abdomen and on the waist flank, and so we did a tummy tuck and really just flattened her out very nicely. And she's bikini ready, as we say.
I mean, I would look and say, wow, she looks good on the before, but she looks fantastic in the after.
We can go to the next one if you like. Now, you can see where the lipoabdominoplasty really comes into play here with the sort of the waist area, where you get that little extra little fat there on the sides. And what we do is we liposuction that, and it really tapers everything and just makes it more refined, and you can really see the difference.
Gives more of a waistline.
Gives more of a waistline.
How much liposuction are we talking about that you can do?
On someone like this, you're probably doing about 1,000 cc's.
Okay.
Which is 3 cans of Coke or more.
Wow.
So sometimes we can go up to 5,000 cc's, which can be 12 or 14 cans of Coke volume.
You can take off more than a 12-pack?
You can take off more than a 12-pack and give them a 6-pack. There you go.
I love it.
There you go. And so she had actually loose skin on her lower abdomen, and you can see now that we've done the liposuction where we've actually removed that fatty area right in the center there, and on the waist and the flank area, and then brought everything down. If you look at the belly button, look at how more refined that is.
Yeah, as you say, cuter belly button.
It's a cuter little belly button, that's right. And so that's the kind of thing that we can do. It's really exciting.
Does this take more time than just doing one?
It does take a little more time.
Okay.
You're absolutely right, because you're doing more things.
Okay.
And so for her, you can see that little pooch there on the sort of the upper part of the screen. Liposuction that out.
And look, it's gone.
And now it's gone. Nice and flat.
So far you've said her. Are there any men doing this?
We do see men doing it. They tend to have more liposuction than the lipoabdominoplasty. It's just the way they're built. And so we sort of get that kind of that spare tire that's around there. We can get that waist flank and that midsection there. I see some hands raised over there in the crowd. So yeah, and you do tend to see more liposuction with men. Okay,
well, you can take care of both, though.
We can take care of both.
Okay.
And now you can see how we've gotten rid of, this is some liposuction in the waist flank area, and we got rid of all those stretch marks.
Yeah, I was about to say, or those stretch marks.
We have the nice, cuter belly button again.
So this person probably had a child?
They usually have had 1 or 2 or sometimes 3.
And that's a great option for women who have had children.
And it's perfect after children, because then you're not going to re-stretch that out and get back into that bikini again. Summer is fun and exciting. And
now, we've heard of vaser liposuction.
We have.
Can that be part of this as well?
This can be part of that. Yep. And so what we can do is we can actually combine the vaser, break up the fat, so there's less bruising, less swelling, and a quicker recovery with this whole process. Typically, people recover within about a week and a half.
Liposuction is not what it used to be when we would see the video that looked so
like where they're jabbing somebody with some giant stick or something.
How has it changed?
The little cannulas, the things that we take the fat out, have become much smaller. Instead of, they're about half the size that they used to be. So what that does is that prevents people from having a lot of bruising and swelling.
Right.
And that's the great thing about it. Plus the advent of the Vaser, where we ultrasonically break up the fat, really what that does is that allows us to take that fat out much more easily in a less traumatic way.
And less recovery time then?
And less recovery
What is the recovery time generally?
Usually about a week and a half.
Okay.
Usually, most people are out and about. I mean, day one, people are up and walking around, and we don't let them just sit around. And within about a week, they're doing whatever they want to do.
I know you always say you want a good, healthy candidate, someone who's in good condition besides maybe just a few spots they're not liking.
And we don't want people who are real sick because they're really not candidates for this procedure.
Yeah.
And so, but it really is a fantastic procedure, and we really enjoy it.
The pictures prove it. Let's put up the information about Cosmetic Surgery Center right off of Shackleford Road there in the Executive Center Drive area. There's the information on the screen and also the phone number to call. If you'd like to ask more questions, just go in for a consult.
That's
you
right.
know, if you're not sure, you know, but you're thinking maybe, just go in and let them kind of tell you what they would do. 227-0707. Dr. Branman, thank you.
Thank you
we
very
appreciate
much.
you coming in as always.
Good seeing you.
We appreciate you. All right. Back in just a little bit. I don't think these guys need